My name is Mark Price. I have been practicing law for 36 years, and I have been practicing healthcare law, both civil and criminal, since 1995. These are some points that are very important that you need to consider if you are being subject to a criminal investigation. You cannot approach that with, I'm not guilty of anything, I'll just fully cooperate. It's good to cooperate, but you need to be aware of certain landmines that exist in federal criminal investigations of Medicare fraud, or sometimes even Medicaid fraud, which the state usually is the primary investigator. Usually 2 FBI agents will come to your office unannounced and want to ask you about some billing, some patients you billed for, some details in charts. They can see the charts if they have a subpoena. You have no choice. If they take the charts, you should ask in front of a witness the right to copy them. You don't have an absolute right, but you really need to. If documentation is missing from your chart and they take it, you can be liable. Now, the documentation might well be in there when they take it, but you have no proof. Occasionally, FBI will allow you, in most cases, if you're represented by a lawyer, to have a third-party copying service copy the documents and number them. It's very important to number the documents sequentially so that each document will have a different number, and that numbering system continues through each clinical chart. Why? Because once the government gets your charts, they can lose documents. Not intentionally, but you must remember that they have hundreds of thousands of documents, usually in one room, maybe for 20 to 50, 100 providers. You have situations where agents on one side of a table will look at documents from your office. Agents on the other side of the table will look at documents from another office. In the hours and days that go by, it's very possible, in fact, absolutely probable, that some of these documents get misplaced. If you don't have documents to support billing, you can be criminally liable and or civilly liable. So this is a very important stage. Again, it's important to say before they talk to you, I'd like to have an attorney present. I've just been advised that any provider should have an attorney present. FBI agents sometimes use the tack, well, if you have nothing to hide, why do you want an attorney? The counter to that, if you're not going to ask me tricked questions, why would you object to have an attorney present? So it's important to have an attorney that has a background in healthcare law, that's seen all the tactics of the United States Attorney's Office and the FBI to try to make a case. It's their job to make a case. So you have to understand that. You have to understand that once you have your set of documents, you should have an expert. If you're a physician, an expert that's a physician in research and understanding of problems, to look at your documents and see if there is a problem. You also need to be totally candid with your attorney. You also need not to talk to anyone that is not an attorney or in your attorney's office or a spouse. You can talk to a pastor, but again, if you talk to your attorney, everyone should be out of the room, whether you're on the phone or in person, because anything you say in a third party's presence can be discovered. It also can be misconstrued. You'd be surprised at how third parties hear things and misunderstand them. Unfortunately, The mindset of humans is to look for the worst in a statement rather than truly weigh it. So it's important you keep a corridor of silence around you about the investigation or anything in it. It's also important that you keep your set of documents secure and available. Usually the attorney will want a second set to work with. The expert physician will want another set to review. Usually the FBI will come back with wanting to have an in-depth interview with you. Your attorney will be present. In any response to any question, you need to listen to the question very carefully. You're under a lot of stress. Your tendency is to answer these questions quickly and get the pain and pressure over with. Not good. You need to understand the question. You need to have the file of the patient before you on any questions about patients. You cannot remember everything. Don't guess. If you guess, you've made a false statement to an agent. That alone is a violation. That alone is a crime. Give you this example, not about healthcare, but it's the same legal example. Martha Stewart was charged with insider trading. They couldn't find anything on insider trading. The jury found her not guilty on the count of insider trading. However, the very last question the two agents asked Martha before they left her office was, had she ever met with her stockbroker for anything except discussing investments? She said no. That was unfortunately a lie. She had been dating her stockbroker. Stockbroker went into great details about their life together. Martha Stewart was found guilty by the same jury, found her innocent on the primary charge of lying to a federal agent. She got 5 years in federal prison for that. So please don't guess. Get an attorney. It is also important to keep your clinical files for at least 10 years. People say 7. I say at least 10. It is also important, and there's many things you need to know, but these are the train wrecks that I've seen. If you have a hurricane or flood that destroys your medical records, you need to immediately document that. You need to have somebody like ServPro to see if they can recover the documentation and give you a written assessment. And you need to report to Medicare and the state health department that license your practice that you've lost these records. If you have any questions about an investigation or other points in civil areas regarding Medicare, Medicaid compliance, I would be happy to answer your questions. Thank you.